Meniscal injuries are very common injuries. One of the most common things, probably the most common things we treat as sports medicine orthopedic surgeons. So the meniscus is a cartilaginous structure. It's C-shaped, serves as a shock absorber. It sits between the femur and the tibia bones and helps to lessen the load and the stress that the cartilage that coats the end of the bones would experience during impact activities. This is particularly important with running, jumping, and a lot of athletic activities. Many times the meniscus tears with ACL injuries with specific moments. We also know that the meniscus over time can tear from nothing in particular, just wear and tear. This kind of creates different treatment algorithms we have for meniscal tears. We have the more acute meniscal injuries, which we often see in our young athletes, and then there are the more degenerative meniscal tears, and the way we treat those are very differently. In the younger patients, we try, if possible, to repair the meniscus because we know the importance of the meniscus in preserving the cartilage, preventing arthritis. So there's a number of different meniscal repair techniques that I utilize, some minimally invasive where we use specialized tools to help perform a meniscus tear through our small arthroscopic incisions, and some larger tears actually do require an open incision and a little more technically demanding procedure that requires additional expertise. We call those inside-out meniscus repairs. I also perform meniscal root repairs and repairs of radial tears of the meniscus. Again, these are mostly in our younger patients where we're trying our best to save the meniscus. With older patients who, especially those who are starting to develop arthritis, many times a meniscal tear does not mean we need to rush into surgery. There are some cases in which there are very large meniscus tears that actually cause the knee to lock up and get stuck. In those situations, we do intervene more quickly. However, in patients who are beginning to exhibit arthritis, many times cortisone injections, viscosupplementation injections, or gel injections are things that we can try to utilize. There are some orthobiologic approaches that are beginning to gain some favor as potential treatment options for these patients. And occasionally, when we try all of these different options and nothing seems to be able to alleviate the pain, sometimes the direction we move is towards surgery. And in those cases, usually what we are doing is cleaning up the meniscus, a procedure we call a meniscectomy, which has a very quick recovery time as opposed to when we stitch together and repair the meniscus, that requires a longer period on crutches. When we just clean the meniscus up, it's a much quicker recovery. Usually patients are back to activities within a few weeks. We do know that patients who have meniscal injuries do have an increased risk of developing arthritis and damaging their cartilage surface, which that's what arthritis is. It's when the treads on the tires start to wear away. The meniscus is the shock absorber, so when we lose our meniscus, we increase our risk of developing arthritis. For younger patients who have very large meniscus tears that are not repairable, sometimes we perform a procedure that's called meniscus transplantation, where we actually take meniscus from a cadaver along with some little plugs of bone on each end of the meniscus, and we repair that cadaver meniscus into the place of the old meniscus. This serves the purpose to try to re-provide that shock absorber. This is a procedure that does come with limitations. It's not your own meniscal tissue, but in the right patient, this can help prevent the patient from going on to develop severe arthritis at a young age, which is a difficult problem to deal with. In these patients that have more complex meniscal injuries that may require something like a meniscal transplantation, it does require a very thorough workup. We have to ensure that the alignment of the knee is okay. We have to ensure that the ligamentous stability is okay before we undergo such a big procedure. So these are not procedures to be taken lightly, but in certain scenarios, these procedures can have very significant benefits for the patient. One of the areas where there's a lot of research now is a meniscus tear that many years ago was not recognized. This has kind of been something that we've noticed over the past decade and a little over a decade, is the meniscus root tear. Research has shown now that patients who tear their meniscus root, what that means is the meniscus root is where the meniscus actually attaches into the bone. So if you tear the root of the meniscus, the entire meniscus can move out of the way. It doesn't serve as a shock absorber. So when you step down, the meniscus essentially squeezes out of the joint. What our research has shown is patients who have those type of tears, when they don't get them repaired, they often progress fairly quickly onto developing arthritis. And there's studies now that are out in the literature that shows in patients that we are able to repair the meniscus. Their knee survives a longer period of time before developing arthritis and before needing a knee replacement.